Hey everyone, welcome back to Graft Academy. Today we're going to talk about one of the most common questions people have before treatment begins. How much does a dental bone graft cost? The short answer is that bone graft costs vary. But once you understand what goes into the procedure, the pricing starts to make a lot more sense. Let's break it down clearly and realistically. In the United States, the cost of a dental bone graft typically ranges from a few $100s to several $1,000s. The reason for that wide range is simple. Not all bone grafts are the same. The first and biggest factor that affects cost is the size of the graft. A small socket graft placed after a simple tooth extraction is the least expensive type. These grafts often cost between $500 and $1,200. They involve a small amount of material and minimal surgical time. Larger grafts cost more because they require more material, more surgical skill, and more healing oversight. For example, ridge augmentations that rebuild width or height can range from $1,500 to $3,000 or more. Advanced grafts involving multiple teeth or severe bone loss can cost even more depending on complexity. The second factor is the graft material used. Different materials have different costs. Synthetic grafts and standard donor bone are usually less expensive. Autografts, which use your own bone, may cost more because they involve an additional surgical step. Xenografts, which are often used for long-term volume stability, can also increase cost due to material pricing. The third factor is whether the graft is done alone or combined with another procedure. When a bone graft is placed at the same time as a tooth extraction, it's often more cost-effective. That's because the surgical site is already open and no additional procedure is required. In contrast, grafts done months or years later usually cost more because they require a separate surgery. Another important factor is the location of the graft. Grafts in the front of the mouth are often simpler. Grafts in the back of the upper jaw, near the sinuses, tend to be more complex and therefore more expensive. Bone quality, access, and anatomy all play a role in pricing. You may also see differences in cost based on technology and techniques used. For example, the use of PRF, specialized membranes, 3D imaging, or advanced biologics can add to the price, but they often improve healing and long-term success. While these options may increase upfront costs, they can reduce the need for future procedures. It's also important to understand what you're paying for beyond just the graft material. The costs include surgical expertise, sterile technique, imaging, planning, follow-up visits, and post-operative care. Bone grafting is a medical procedure, not just a product, and experience matters. Now let's address a common concern. Is bone grafting worth the cost? In most cases, yes. A bone graft preserves bone, prevents future bone loss, and makes implants possible. Skipping a graft when it's needed can lead to more expensive procedures later, including larger grafts or failed implants. In that sense, a graft is often a cost-saving step over the long term. Another important question is insurance. Some dental insurance plans partially cover bone grafting when it's medically necessary, such as after an extraction or due to periodontal disease. Coverage varies widely, so it's important to review your plan or ask your dental office to check benefits for you. To summarize, dental bone graft costs depend on graft size, material type, location, and timing. Small socket grafts are the least expensive. Larger or delayed grafts cost more due to complexity. When done at the right time, bone grafting is often a smart investment that prevents bigger costs later. Understanding pricing helps you plan confidently and avoid surprises. Your dentist can explain exactly what type of graft you need and why, so you know what you're paying for and what to expect. If you found this video helpful, make sure to like it, subscribe to Graft Academy, and share it with someone researching dental implants or bone grafting. We post new educational videos every week to help you understand modern dentistry in simple, clear language. Thanks for watching, and we'll see you in the next episode.